3 tests that the pharmaceutical industry doesn't want you to take. That's right, you heard it. If you keep track of these tests and keep your markers low, you greatly reduce your chances of developing diabetes, Alzheimer's, cardiovascular diseases, and even cancer itself. In 2024, the pharmaceutical industry made about $1,240 billion from medications, and this impressive revenue is only possible with loyal customers. If you have high blood pressure, for example, you'll hear from your doctor that you have to take these medications for the rest of your life. Diabetics hear the same thing, and thousands of people take 3, 4, even 5 medications continuously. That's exactly what the industry wants, to keep you alive but always sick. So, in this video, I'm going to bring you 3 tests that, if properly monitored and kept under control, will prevent most chronic diseases, and in some cases, there may even be a reversal of some diseases. So watch until the end, because we're going to talk about which tests these are, the proper levels, and most importantly, what to do to keep these tests under control. Of course, this video already deserves your like, your thumbs up, and it also deserves to be shared in your groups. Make sure this information reaches as many people as possible. And tell me in the comments, how many medications do you use continuously? My friends, don't forget to visit my website. On my website, you'll find all the supplements I use and recommend and that you always ask me about. Moacir, what's the best omega-3 and what's the right dose of vitamin D with K2? Everything is on my website. My courses are there too, my other social media as well. It's easy to find me. Just type Moacir Rosa on Google and you'll find me. Most diseases give a sign that they're coming, but you need to evaluate these signs very carefully to prevent a disease from appearing. It's much simpler, cheaper, and more efficient, but you need to evaluate these signs and these tests correctly. Take the case of diabetes, for example. Most people control it through blood sugar levels, which is the amount of sugar in the blood. If your blood sugar is below 99, you get all happy. My blood sugar is great, it's below 99. I don't have diabetes, I don't have prediabetes, or when someone is diabetic, it's under control. Isn't that right? When your blood sugar goes up, it reaches 110, 120, 130. You already have a case of diabetes, and it could be that your blood sugar is normal because of high insulin levels. And this is the first test I want to show you here. It's insulin that makes you diabetic. The rise in blood sugar, the rise in your glucose level is a sign. It's a symptom. What made you diabetic was insulin resistance. Too much insulin at the receptor causes resistance, causes metabolic syndrome. And first you become pre-diabetic, which I don't even like that term, and then you become diabetic. So you have to be vigilant about your insulin levels. What levels are those? Moacir. Preferably below 5. I know that on the test it says that between 3 and 13 you're normal, but you're not. Anyone with insulin levels of 10, 11, 12, or 13 already has metabolic syndrome. That range the lab gives is just an average of the population. Unfortunately, the population is overweight, inflamed, and for the most part already pre-diabetic or diabetic, so you need to keep your insulin below 5. And diabetes doesn't just bring the classic problems, like over time you could go blind, lose a limb, or end up on dialysis. This insulin resistance also increases your inflammation. A diabetic has a much higher chance of developing cancer, having a heart attack, having a stroke, and a series of other diseases. It's also interesting for you to check, along with your insulin, your glycated hemoglobin, which measures the glycation of erythrocytes. That will measure how your glycation level is. It's glycation that causes the biggest negative factors of diabetes. But if my insulin is high, what happened? What can I do? How can I reduce this insulin? Well, you're probably overdoing it with carbohydrates, too much sugar, too much processed food, soda, flour-based foods, right? If you like bread, cake, rolls, cookies, all of that has flour. Wheat flour is a carbohydrate, and not just wheat flour. Corn flour, manioc flour, all of that is carbohydrate. So the more carbohydrates, the more insulin. The higher the insulin, the greater the insulin resistance, and the faster the path to diabetes. So the first test I want to bring to you is fasting insulin. If you change your lifestyle habits, you can reduce your insulin, for example, from 10 to 5 in just a few weeks, okay? Second, homocysteine. Homocysteine is a cardiovascular risk factor that's more dangerous than high cholesterol. And few people give importance to this test. Few doctors request it, and when they do, they evaluate it incorrectly. Homocysteine attacks the endothelium of our arteries, which leads to the formation of atheroma. And this, in the future, can cause a heart attack or a stroke, and it doesn't stop there. Excess homocysteine also attacks our neurons, which can lead to dementia in the future. Just look at the size of the problem. Why does homocysteine increase? Moacir. I'll talk about the ideal homocysteine level later. It usually increases due to a failure in remethylation. This homocysteine comes from methionine. So many times it is remethylated and turns back into methionine. But for this to happen, you need folate and you need B12. If you have low levels of folate and B12, this remethylation doesn't happen and you end up accumulating homocysteine. A failure in transsulfuration can also happen where homocysteine is converted into cysteine and then into glutathione. But for this to happen, you need vitamin B6. If your B6 is low, this doesn't happen. And then you have a buildup of homocysteine. You must already be wondering how to lower homocysteine, right? You probably already figured it out. And that might be happening too. Low methylation. This low methylation can be due to excessive alcohol, due to fatty liver, the ideal level of homocysteine. Moacir, preferably below 8 Moacir, but mine was 13, 15, 14. It's high. What should I do? Calm down. Remember I talked about cofactors for remethylation and transsulfuration to happen. That's exactly what the treatment is. You will use methylfolate, which is folic acid in its methyl form combined with methylcobalamin, which is vitamin B12 in its methyl form, and 6, which is the active form of vitamin B6. You can find this at any compounding pharmacy. On my supplement list on my website, there's a product called Superfolac. The dosages are listed there, okay? Just go to my supplement list, and you'll find the dosages for these 3 elements there. And finally, inflammatory markers. High sensitivity C-reactive protein is an essential test to measure your subclinical inflammation. A lot of people worry, for example, about cholesterol. Oh, my cholesterol is high. My low-density lipoprotein is high. Your high cholesterol is only a problem. If you are inflamed, it's the inflammation that oxidizes the small, low-density lipoprotein particles and will generate the atheroma. Inflammation needs to be low, and that's where C-reactive protein comes in to show us how inflamed we are. What is the ideal C-reactive protein value? Moacir bomb. I like to work with values below 0.5, but if you can at least get it below 1, that's already great, right? First, let's reduce it to 1, and then we'll work to bring it down to 0.5. So, the lower your C-reactive protein, the less inflamed you are. And inflammation isn't just a problem for cardiovascular health, okay? All chronic and degenerative diseases have an inflammatory background. Arthritis, arthrosis, Alzheimer's, Parkinson's, cancer. The higher your inflammation, the greater the risk of developing these diseases. Always assess the ultrasensitive C-reactive protein along with other inflammatory markers such as fibrinogen, ferritin, interleukin, 6, and tumor necrosis factor alpha. But why is my inflammation high? Moacir again, poor quality food. Look, notice that the 3 markers are linked, right? Usually the cause is very similar. In the case of increased inflammation, it doesn't change much. It's the excess sugar, excess processed food, excess hydrogenated oil. Okay? That hydrogenated oil you use for cooking, and the hydrogenated oil that's present in processed foods, fructose that's present in processed foods. Excess gluten that's present in wheat flour. Look, wheat flour not only raises your insulin, it also increases your inflammation. And of course, right? Alcohol is one of the biggest factors that increases inflammation. My friends, my website, okay? Don't forget to visit my website. It's easy to find me. Just type Moacir Rosa and you'll find me there on my website. It has all the supplements I use, the ones I recommend. My courses are there, my other social media as well. Don't forget to visit my website. Did you like this content? Don't forget to share. If you forgot to give a thumbs up earlier, give a thumbs up now. And if you're not subscribed to the channel Meus Amigos, it's free, you don't pay anything, just click subscribe. Don't forget to hit the bell and make sure to select all. I hope you enjoyed this video. I hope it was useful for you. Pay attention to these tests. They can help prevent you from getting diseases and can even help you reverse diseases you already have, like diabetes or hypertension, for example. So it's very important for you to keep track of these tests. A big hug, my friends, until our next conversation, okay? See you.